Hi, I'm Dr. A.B. Mendelsohn. Gender-affirming surgery is so much more than just a medical procedure. It's a result of personal journey, resilience, and transformation. We would like to learn directly from gender-diverse individuals as they share their experiences, challenges, and hopes. As such, we present their voices. In this episode, we discuss significant mental health challenges. As if you feel that you are suffering from this, please make sure to reach out and get the support that's needed. So many different resources are available. Hopefully, friends and family are important to start, your medical care providers, as well as important institutions like the Trevor Project, which is available in the information below. Welcome to episode 6 of Their Voices. Today we have an amazing treat. We have the incomparable Dr. Justine Lee, who I've had the pleasure of knowing for a long time. But I'm looking forward to today to getting to know a little bit better. So welcome.
Yay. Thank you so much for the invitation. And it's an honor to be on this podcast.
Okay, so yes, you are double Dr. Lee, obviously MD, PhD, but I'm going to try to hold my praise to a minimum because we're going to try to keep this. In that vein, I'm actually going to also do away with the doctor. And Justine, welcome.
Yes, Amy. And you know what? I will not make that promise. I will not keep the praise of my friend Amy Mendelsohn to a minimum. But we'll let you go first.
We'll try. Okay.
We'll let you go first.
You know, I think we do equally poor with praise. So let's just. We've known each other let's say we've worked together. Mm-hmm. On specifically gender-affirming care, collaboratively, I want to say 8 years, 9 years?
It's about right.
Is that about right? It certainly has been magical to me. How far back do you track your own journey professionally from a gender-affirming standpoint?
Well, this is a funny question that you ask, because my first year in practice, a trans patient came to me, and this is 2014. So at the time, it was my first year in practice, something I've never, had no experience with, have never really talked to a trans patient before about facial surgery. So we get going, and we start talking about it, and it was like I was a deer in headlights, not sure even how to get this person through insurance. And sure enough, we said, okay, well, let's give it a try. Submitted it, and it was denied. And then, that patient went away sad, and I never saw her again until 2016, 2017, and all of a sudden, we started having this little trickle, and amazingly through insurance. So back at that time, just for historical context, 2008 was Vermont as a first state that supported gender-affirming care. 2013 was California. That was the first state that supported gender-affirming care. But in those years, most of us didn't know what to do, how to do this, what to say, who we needed, so on and so forth. There were no thoughts in terms of like, okay, well, I really need a primary care doc. I need, so on and so forth. I need all these people in line to also verify with me and that this is the best care for the patient in addition to the patient. Fast forward to 2016, passage of the Section 1557 of the ACA, the Affordable Care Act, which then included gender non-discrimination as part of health insurance. Then that opened the federal doors, which then opened more state doors, as well as the private insurers and anything that's funded by the ACA to just not have gender discrimination in providing health care to people.
How weird was that?
I know. It was law.
It was law, but we also think about how isolated this entire community was.
Right.
And this was not a long time ago.
No. Literally no health care prior to then for these reasons, that so people and this was, I'm sure you have many patients or shared patients, so on and so forth, were finding their own ways on trying to help themselves. And that meant, doing risky procedures,
Mm-hmm.
Self-administrating hormones,
Yeah.
going abroad, and just not really having evidence-based healthcare for that we would have for pretty much any condition.
Absolutely. It boggles my mind how anyone was able to navigate the system, because even at this point where we are getting so many people having insured based care, but more importantly, it's such a collaborative effort at this point in
Hmm.
time that even if they were able to identify reputable and trustworthy providers, whether surgical or medical, um, which is a big assumption. But even if they were, they had to do it individually, and it doesn't work that
Hmm.
way.
Hmm. Hmm.
It's almost impossible. So, um, yeah, glad we're not there anymore.
Right.
So, so here we are, exactly right. Yeah, and I had the same thing where it was very much like I saw what was possible, and for me, my first introduction to this field was in Europe.
Hmm.
And seeing in Belgium, seeing my first vocal feminization surgery, I was like, this is incredible.
Hmm.
And then it just kind of stayed there on the shelf until it became a practical reality.
Hmm.
And yeah, so that, and then it took off. What what kind of resonates for you when you think about, like, there are so many ways you in craniofacial surgery, there are so many life changing patients that need your care, but something special here resonates with facial feminization. Like, what is it about facial feminization that allows you?
Well, I think our generation of physicians that care for patients in the gender affirming space, we all came from something else, right? So you help people with cancer.
Right.
I help kids with congenital issues. They're born with clefts, so on and so forth. And I think when the laws changed and all of a sudden we started seeing patients who needed us, and then we started helping patients who needed us, then there was something that kind of clicked where it was so gratifying to help someone who really didn't have other options. And I love helping my kids, love them, still love them. But and I don't get enough time to help them enough these days. But that said, I'm not the only person who can help the kids. That there's generations of us trained to do that, and there were no generations at the time trained to help our gender diverse community. There are no generations of people that had even sort of any regimented
Right.
understanding of what was possible at that point in time.
Yeah. So that's what even blows my mind even more about you, because not only do you do like amazing work, but you have literally written the playbook on how to do this, right? How to allow someone's face to be recognizable to their inner face. And okay, I don't know how you did it. I don't know how you do it, but how did you even start without, anyone showing you the way? Like, how'd you do that?
Okay, AB, I'm going to get to the praise on you in a second. So you're going to
Yeah,
get
honestly,
very embarrassed. But okay, I'll kind of preface it with so I come from a background of like artists, especially on my mom's side. So grandpa's an artist, mom's a great artist. Mom is more like self-taught. And so it's a little bit in the blood. So we grew up like doing these sorts of like very creative activities. And so it's sort of a little bit ingrained in me. That's kind of how I ended up finding plastic surgery, because of all the medical disciplines out there, it's the one that actually is more derivative rather than sort of algorithmic. So, for example, if you have an appendix problem, you get an appendectomy. Pretty straightforward. If you have, something wrong with something else in your body and you need surgery, you get it out, or so on and so forth. In plastic surgery and plastic reconstructive surgery, we're guided by like just kind of principles. And those principles are, principles of transferring tissue, reconstructing things, and all of that. So when we don't have a playbook, that's kind of like a daily life situation professionally for us. But it's a very fun situation because you just sort of think about, okay, if I were to do this for another reason, any other reconstructive reason, what would I do?
How do I apply those
Right.
principles?
Or, a lot of, like, for example, in the kids, we're moving the forehead forward because they weren't able to grow their skull appropriately and they needed more space for their brain. So this is the same thing, but going backwards. And, various things related to the jaw, very similar to other things that we do. And then the soft tissue work is a lot of, it's a lot of listening. Because that's sort of, the bony work that we do is like construction, and the soft tissue work is like the interior design part. And the only way to do that is to like sit down and to listen to the patient and to figure out what are the parts that are the causes of dysphoria and what is their vision of what they see in their heads.
Right. Because as we've heard over, it's about them.
Right. It's on my face, it's their face.
Exactly. But it's also not I'm going to make you the ideal Barbie doll. That's not,
right.
You've never done that. And that's never been your approach. And I think that's one of probably the many reasons why you've been so successful in terms of, changing in a positive way so many people's lives. When you try to teach and successfully teach with congratulations on your fellowship.
Thank you.
Amazing.
Thank you.
And you are successfully teaching and writing papers, textbooks. How do you teach what you just described to me, which sounds to me like, okay, I'm so glad that the world has you, but how do we make more of you? I don't know that answer.
AB, how do we make more of you?
Yeah, well, thankfully not.
Well, I think we might have some similar styles in teaching, which is pretty much we just integrate. When people come into the operating room, what do I see? What do you see? So on and so forth. I would say from the very, very beginning for myself, I'm an ally. I am not part of the community. And so I wanted to integrate as many voices in the operating room as possible, including members who are in the community. So we have this funny thing that we call quality control. So quality control is every time we're done with any area of the face, before we move on, then everybody looks. And it's like myself, all the trainees, the medical students, and nursing staff, or industry reps who are like delivering instruments and tools and stuff like that to us. Everybody looks and tells me if there's something that we got to correct. Because if we're going to fix it, this is the time, right? Everything's possible there. So I think the integration makes people feel invested in it. They see what I see. They're not here just to, spend a couple hours with me and then leave and I'll see you later. But then they also sort of feel it. Yeah. And I think you do the same.
I do. Absolutely. I just want to say that's insane that you do that in this surgical training that I'm sure we both came up in. For a surgeon to offer themselves up for external opinions before, during, after surgery was unheard of. And still in many operating rooms, I'm the surgeon. I will tell you what's right. I will tell you what's wrong. And you're there to serve my needs. I mean, that's how a lot of operating rooms run. And that always seemed insane to me. And it does to you too. Yeah. And I think, we absolutely see eye to eye that. I try after a tracheal shave to make sure that everyone could tell me if I could do a better job. Like, is there something that you see? Maybe there's an angle, there's a shadow. Let's put our hands on the neck. Let's feel, do you feel any bumps? I mean, why wouldn't you want everyone's opinion on that? It only makes sense.
Yeah, it does. I mean, I think you have to have a certain level of confidence in your own abilities to be like, I am not scared to
Right.
receive that criticism. In fact, I welcome it because I can do something about it right now.
Right.
And if we leave the operating room, this is going to be a reoperation, or I will be unhappy about it. But before we move on,
Yes.
I am going to get started now. So it is about time. I mean, enough about me. So,
I don't know.
you know, when we started this together,
Yes.
so I'll say from my standpoint, I'm like, oh, geez, this tracheal shave stuff. I mean, it sounds easy, but if I mess up, this is not going to be good. And so then in comes Dr. A.B. Mendelsohn, who then comes and does this, and it's been a partnership ever since. And most importantly, you then pioneer the technique of coming through the mouth.
Right.
And now you are literally the world expert on doing this. And so I think it's more important to hear also about your journey, because we did this together in parallel. Some things, in parallel going simultaneously, but not necessarily, in the same operating room, and then some things in the same operating room. So what was your thinking process in going into this whole new thing, same thing, like nobody knew what you were doing?
Yeah, absolutely. The endoscopic tracheal shave had to be a collaborative effort. First and foremost, with a plastic surgeon, a craniofacial surgeon, who was able to recognize that the larynx, the voice box, is not part of the face. It sounds like it shouldn't be that much of a novel concept, but yet it still is. A lot of people say, hey, tracheal shave, FFS, same thing. It's apples and oranges. It's different level of training, different level of expertise, understanding the anatomy, physiology. So just what you're talking about, your confidence and security about, I have strengths. I don't get everything perfect. I need to bring in other people. That allowed this to happen. You allowed this to happen. And so first and foremost, just having an open door to maybe, some people feel like, oh, this is mine territory, get off of this. No, let's do this better. Let's do this better. And so initially, I actually think maybe our first collab effort from Facial Femme and Tracheal Shave, I think we did one or two open, cutting the neck. And just like the quality control, my own quality control was like going off. I was like red light sirens. I'm like, that is a cut on the neck that shouldn't be there. It doesn't have to be there. And just that very thought was like, okay, enough to say we can find a better way. And resting on your confidence, meaning you supported me because I was like, is this crazy? And you're like, nah, it's not crazy. I'm like, it's a little crazy. And it was a little crazy in that we were going to shift the entire paradigm of how we address this. And it allowed us to do that. But the quality control concept that you talked about was exactly how we have landed where we are, where we're at 300 endoscopic tracheal shaves. There are 300 women in this world and non-binary individuals in this world that don't have a cut on their neck and have a beautiful, beautiful, beautiful contour that matches who they are. The quality control was Chris making sure that we got that instrumentation. I remember in the surgery center, I was doing another one, and Gio, who runs the nurses and the techs there, he walks in, he's like, "Oh, you need to be using this instrument, or you need to do this," and getting everyone on board, so that taking that concept and making it reality was something that it only works if you open yourself to making sure that you're listening. And then lastly, it was, not every surgery goes perfectly. And I remember coming to you and in some of our darker times early on, learning dealing with some less than optimal um, outcomes and saying, maybe we just throw it all away. Maybe we just scrap this. But your knowledge of there are people out there who need us, need the work that we do. You were absolutely confident. And that provided me with the confidence to say, yeah, let's move this forward. And I love where we are right now. Love it.
Yeah.
To learn more about our gender-affirming surgical services, please visit our website at www.genderaffirmingcarecenter.com.
Yeah, I mean, it's such an interesting journey, right? Because I remember like the discussions, and I'll say that initially when I left the room, it wasn't because of just lunch. I was terrified.
Terrifying.
I'm scared to watch this. I can't watch this. I gotta.
It's absolutely terrifying.
But that said, what I think similarly with myself, that was totally in your wheelhouse. So you are a minimally invasive surgeon.
Yeah.
You're doing the same stuff for other reasons. You break out the robot and all that for other reasons. And so, I think that level of understanding and expertise with being a minimally invasive surgeon was how this happened.
Yes. Yeah. And it really was constantly trying to find better ways, which is how not only our collaboration, but really this entire field is moving in the right direction. It really is.
Yeah.
It's exciting to see where it goes. A little bit I get sad because I look back, I'm like, oh, I think I could have done a little bit better job. I see some of my earlier pre and post photos. Now with my experience, but that's just the nature of all things. We're just constantly evolving, and we're going to teach, and we're going to make sure the next generation does better than our generation, and we're going to keep moving that forward. It's something really, really special. Speaking of the next generation. All right. So again, I try not to go too negative because we're trying to, communicate messages of positivity.
Right.
There's funding cuts that have happened, and there are more funding cuts coming up in all aspects. In aspects of the institutions, community partners that are supporting the community, but more important to you as a surgeon scientist, specifically cutting the legs out under you as a scientist. How are you dealing with that?
Well, it's been a tricky time. It's been a tricky year. We're all learning and we're all adjusting to these tricky times. But I'll say that so the federal funding cuts in research, which is like the other half of my life, has been really, really difficult for most scientists around the country, whatever it is that they're studying. It doesn't really matter. It's just overall great anxiety, if not directly affected, indirectly affected, if not indirectly affected, impendingly affected. And these types of things, scientists, whether they be physician scientists or other types of scientists, they're just trying to do some good in the world. They have spent their life trying to do some good in the world. And to have that additional added stressor is really unfortunate. I think from the standpoint of gender-affirming care, well, that was deleted as something to fund. So that's one problem there. So in the sense of like, we're making progress in understanding and improving outcomes and all of that. And it would be nice to continue doing that rather than to be halted, right? And so if we don't have evidence, well, we don't have evidence then. And we're just not moving on, and we don't know if we're doing better or not.
Just to jump in there, because it's wild when we think about patients' current day in the office, right?
Right.
We a lot of times will get pushback. Well, there's not enough data, not enough science to support what you're suggesting. Like, this doesn't really help someone. This doesn't make a difference in our life. And we're like, trust me, it really does. Like, no, we can't trust you. We need science. So you, as an incredible person who's not only spending days in the operating room hours and hours and hours. But you're like, no, let's develop that science. And they're like, no, you can't develop the science either, right? So you're just like, well, you have us at a pretty interesting conundrum here, because which one do you want us to do? Do you want us to tell us how it is? Yeah, so let us do that. They're like, no, we don't want that. And they're just assuming that this is just going to be ignored forever.
Right.
It's so frustrating.
Yeah. I mean, and federal funding is going to be the biggest source of funding for research. So nothing states and foundations will pale in comparison, because it is the federal government after all. But I think what it has done for scientists all around is like really come to the realization that, wow, we thought of this incorrectly, because we should have never been at the mercy of the federal government. People in their personal finances, the rule of thumb is diversify your portfolio. Right. Well, we never diversified, because once you got federal funding, that was, that was going to be the source forever. And so everything, from what I do scientifically, all the way down to just making materials to help with healing in surgery, that was affected, which had nothing to do with gender-affirming care.
It sounds like a really horrible use of research dollars to make sure that surgery is just done better. It's just like, sounds
here's some new technology.
I hate to always bring it back to the money, but that's kind of where we're all halted. This is how our journeys began, because of the money for those patients. When you bring up that prehabilitation, it was such a light bulb when you brought it up, meaning such an obvious concept, but it needs someone to bring this up. It's obvious that the better prepared you are into any situation, certainly a life-altering surgery, the better you're going to do afterwards. I know it's something that I continue to struggle with, because there are obviously our ideal patients who come in well-educated, thought out. There's no question this is going to be the right next step for them. They are ready. They do not suffer from housing challenges. They're good, right? But then there are lots of other patients who, let's say, I don't get a warm and fuzzy feeling. Like, I'm not sure how this person's going to be doing during and after the surgery. I'm looking to do those better. What are some of the things that you're doing to kind of like make that better?
Well, I think it starts with, a bit of counseling if the patient is receptive, in terms of, and many are, not everybody, but many are, when you're coming at them from a place of care, kind of like, I want this to be the positive experience that it ought to be. And so, what's going on here, there, and there. So, and then what's your stress level here, there, and there? Because what we know is the more stressed out, more depressed, more anxious, less stable you are from a mental health perspective going into surgery, well, that will potentially make you just that after the stress of surgery, that it might even augment things. And so then, I think for both of us, we pretty much have to lean on our behavioral health colleagues and, their sort of recommendations. And I think, that they obviously have so much more expertise in this, and they're really the ones that really guide, is this patient ready, or is this patient someone who needs a little bit more time doing X, Y, and Z?
Yeah, and I feel myself tap dancing, and I can imagine you feel very similar, in that we understand that mental health preparation and optimization, like we want you in the strongest possible mental state to handle things that are going to stress you.
Right.
Objectively. Sorry, there's no discussion. Right. This will stress you.
Right.
So we want you as strong. The problem I find is that there's this like, oh, you think I'm crazy? Oh, you don't believe me? Because of some of the narratives that are out there right now.
Right.
So I find myself not being able to do what I might think is best for those patients, because I'm fighting against a narrative of, oh, you're crazy, this is all in your head. I'm like, no. We all need a little mental health support. Who doesn't?
Yeah. I mean, every therapy's good for everyone.
Come on now.
There's
So-
nothing wrong with therapy. Everyone should have it.
I mean, literally. I mean, God bless whoever's watching this and they feel like, I
Yes.
got this. Great. Do your own podcast. But for the rest of us,
Right.
like, let's understand, like, when we recommend therapy, we recommend that you have an evaluation with a mental health provider. Yes, there is an aspect of that that's going to be required from a financial reimbursement. Patients need to have an evaluation to affirm the diagnosis of gender dysphoria. Okay. But don't stop there. Like, lean in.
Right.
Get
right.
into this process.
Right. Yeah. I mean, I think of it sort of like if you replace it with something that's not charged, right? So nutrition, if someone has poor nutritional status going into surgery, you'd have them see a nutritionist and, and you'd follow those directions in order to optimize yourself. Same thing.
100%. And going back to some of my earlier learning points, one of the early surgical complications that I wasn't a cloud patient, obviously, I wish it were, that I faced was a patient who not only had those emotional stressors, maybe not optimized, but also nutritionally. And so they did not heal. And it was an eye-opener exactly to that point. Like, you can't just like jump in here. You got to prepare, you got to do that. And so the better that we're going to do that, the better I think everyone's going to do. And ultimately will allow us to show the world the positivity. And I think that's good. Let's talk a little bit about your amazing new, I mean, this is something incredible. So you were talking about diversifying. So
Yeah.
It's a lovely concept, but how does one diversify their research funding?
So, you know this already, but for everybody else, we started a foundation and it's called the Reface Foundation. It's a 501c3. I started that September 1st. So brand new. We just got, yay. Ira said that it's okay to be a nonprofit. Yay.
We'll take
but this foundation is, I called it Reface because it's kind of like a reconstructing faces, but also rethinking, reimagining science, and also just kind of rebuilding lives. That's the whole point of that. And it's about research. There aren't a ton of foundations that are focused on the things that I care about, gender-affirming facial reconstruction, about surgical technologies for regenerative reasons, for making my surgeries, whether it be for the gender diverse population or for anyone getting craniofacial surgery, better. And so this foundation, the goal is to be able to fund these research projects, fund people who are doing the work in the research projects, whether they be like technicians, students, statisticians, so on and so forth, and be able to fill the gaps that the federal government is currently leaving in order to fund the things that can be that can help progress.
Yeah, again, some of these obvious statements that we've been saying for the last little bit, I mean, it's needed.
Yeah, it is needed. And I think, my only regret is I didn't do this sooner.
Right.
This is something that it just isn't ingrained in scientists, but I think it's so important to really just go and really democratize the process, go directly to the people. Do you care about what we do? Yes, no. If yes, this is how you can contribute directly to what we do. We don't have any administrative costs because there are no employees. Everyone's a volunteer. And it will just go directly to either an experiment or a person administrating surveys, entering things into databases and so on and so forth, or materials that we have to print, like postcards.
There you go. Well, we have to spread the word. I'm sure a lot of people either watching or hearing about this. Well, I hear about so many different charitable organizations.
Yeah.
So first and foremost, if you're not already convinced by just getting to know you, that just as an aside, I was very proud to be amongst the earlier contributors, and I hope to we'll hopefully continue to drop some support in there because we love what you do. But understand also, this is someone, yourself, who's own research grants have exceeded millions of dollars through the federal NIH government. So this is already someone who has, this is not a hobby for you. This is, you are a professional scientist who has unbelievable training and has a track record of successful research. So this is not like, oh, I just want to support just generally the gender affirming community or research. You know, now that we know that research, surgical sciences is being slashed, this is someone who will be successful with those dollars. So it
Thanks
needs
for
to
the
be,
props.
no, 100%. So we're trying to, we'll definitely be putting the link up there. We're going to hopefully drive as many people to consider it. Hopefully they'll spread the word to say, can we circumnavigate some of those political issues here? Just say, hey, we want a certain world. Let's help build that world. I think you're doing that, and hopefully we can recruit other people to join you and join us.
Thank you so much. Yeah, I hope so. I mean, it's good. This is an experiment of itself.
Right.
Yeah, this is not the normal way we do research, but these are the times that demand we be a little bit more creative.
Well, it's like what you do in the operating room. Yeah. You know, we did things a certain way, and if you identify whether it's by need or just simply by observation, there is a better way to do this. Let's do that. You know, we're not going to let anything hold us back.
Right.
I personally feel so blessed to not only have you here on the podcast, but have you in my life and being such an important figure for me. I just wanted to say thank you from the bottom of my heart.
I am blessed to have you in my life, saving me from this scary, scary neck.
The vocal cords are terrifying.
They're scary.
But you have mentioned moving the forehead backwards and forward. So that terrifies me. So I think we all just stay where we're comfortable and do what we do best. And yeah, you're amazing.
Oh, you're amazing. Love fest.
Yay.